under the mentorship of Dr. Ari Fleshman. To start off, I wanted to show a quick video that kind of represents why I want to go into medicine and what I really want to do. And it's a good kind of video for anybody, young students or people that are going into a career, something to look to and follow in life.
I was lucky. I found what I loved to do early in life. Ross and I started Apple in my parents' garage when I was 20. We worked hard, and in 10 years, Apple had grown from just the two of us in the garage into a $2 billion company with over 4,000 employees. We had just released our finest creation, the Macintosh, a year earlier, and I just turned 30. And then I got fired. How can you get fired from a company you started? Well, as Apple grew, we hired someone who I thought was very talented to run the company. And for the first year or so, things went well. But then our visions of the future began to diverge, and eventually we had a falling out. When we did, our board of directors sided with him. And so at 30, I was out, and very publicly out. What had been the focus of my entire adult life was gone, and it was devastating. I really didn't know what to do for a few months. I felt that I had led the previous generation of entrepreneurs down, that I had dropped the baton as it was being passed to me. I met with David Packard and Bob Noyce and tried to apologize for screwing up so bad. I was a very public failure, and I even thought about running away from the valley. But something slowly began to dawn on me. I still loved what I did. The turn of events at Apple had not changed that one bit. I'd been rejected, but I was still in love. And so I decided to start over. I didn't see it then, but it turned out that getting fired from Apple was the best thing that could have ever happened. The heaviness of being successful was replaced by the lightness of being a beginner again, less sure about it. It freed me to enter one of the most creative periods of my life. During the next 5 years, I started a company named Next, another company named Pixar, and fell in love with an amazing woman who would become my wife. Pixar went on to create the world's first computer-animated feature film, Toy Story, and is now the most successful animation studio in the world. In a remarkable turn of events, Apple bought Next, and I returned to Apple, and the technology we developed at Next is at the heart of Apple's current renaissance. And Maureen and I have a wonderful family. I'm pretty sure none of this would have happened if I hadn't been fired from Apple. It was awful tasting medicine, but I guess the patient needed it. Sometimes life's going to hit you in the head with a brick. Don't lose faith. I'm convinced that the only thing that kept me going was that I loved what I did. You've got to find what you love. And that is as true for work as it is for your lovers. Your work is going to fill a large part of your life. And the only way to be truly satisfied is to do what you believe is great work. And the only way to do great work is to love what you do. If you haven't found it yet, keep looking and don't settle. As with all matters of the heart, you'll know where you find it. And like any great relationship, it just gets better and better as the years go on. So keep looking, don't settle.
Awesome. So the big reason that I wanted to show that video is I feel like it's really inspirational for students as we're graduating and going on into college or into careers. It really makes a big difference when you look at what you want to do and how it's going to affect you for the rest of your life. You want to do something that you love. And I fell in love with medicine at a really early time in my life, and I've always had a dream of being a doctor. So that is something that I live by and strive to do every day. So like I said, studying anesthesiology, a little bit about me. I'm 18 years old, senior at Frisco High School. I am a first-year ISM student, and I am studying anesthesiology. I'm also involved in the health science program available at the CTE Center. So that also gives me a little bit of intro into the health care field, which is really nice. My quote, "The price of success is hard work, dedication to the job at hand, and the determination that whether we win or lose, we have applied the best of ourselves to the task at hand. This quote really stands to represent me because I'm determined. I like to put 110% of my effort into anything that I ever do. So whether you are number 1 or number 3, it really doesn't matter as long as you have given it your all and you feel confident that you tried your hardest. In ISM, I hope to gain a high level of knowledge in the field of anesthesiology through the guidance of a mentor. I'll strive to learn, to heal, and aid those in need, and treat all I encounter with a high level of professionalism. For me, I want to help people. That's been my goal for the longest time. So through ISM, I hope that I can transmit that goal into real-world experiences. A lot of you guys probably don't know what anesthesiology is. Most people think it's just the person that puts you to sleep, which is partially true, but it's a little bit more than that. It's the practice of medicine dealing with the relief of pain and the care of patients before, during, and after a surgery. And then anesthesiologists are basically the central role in the operating room. They deal with emergency situations. They deal with regulating heart rate, oxygen levels, all of that. So there's more that goes into that than just putting you to sleep, sitting there and waiting for the surgery to be over. It's a lot more. So this career is a really great field to go into because it's readily available. I mean, you always need an anesthesiologist for any kind of operating room. So you can't really do a surgery without an anesthesiologist, and that's the great thing, because as time goes on and more of the older generation, or of our generation gets older, there's going to constantly be need for healthcare, and as the life expectancy gets longer, there'll be more need for a high level of care that we can provide. Now I'm going to talk briefly on my research assessments so I can get more into my original work. For my first research assessment, I talked about global health outreach programs. I learned that many anesthesiologists and healthcare providers in general don't know a lot about these specific opportunities because they aren't always broadcasted to the medical students or the residents. They're not always given the opportunity to know about this. I found that at least 81% of anesthesiology residents would be interested in such a program if given a way to get involved. So I see that there's a big lapse in who knows about these programs and who's actually doing them. And that's something that I found very interesting. On my second research assessment, I evaluated the effect of social media on today's medical profession. You have to be really professional when working in a medical field, especially with patient information and everything going on with identity theft and confidential information. It's just more and more of a precedent that you have to be delicate with these kinds of material. Third research assessment, I talked about the effects of teaching professionalism and just high level of communication skills with anesthesiologists in training. Now the important thing about this is you're always talking to patients, you're always talking to other people, so if you don't know how to talk effectively, you're not going to be able to do your job effectively. Fourth assessment was about substance abuse and how it can be avoided in academic anesthesiologist departments. So a big thing with substance abuse, a lot of doctors would resort to this because of the high levels of stress, high levels of care that they have to provide, just all the things, different variables that come around on them causes patients, doctors, healthcare providers to have a high level of stress. So something like this is a major issue, and it talks about a lot of strategies that can be implemented to avoid problems, such as more clinical care, giving the doctors more time to go out in the field and do what they love instead of having to be in the classroom and focus on work. And on my 5th research assessment, I talked about the changes in healthcare currently going on and how more lower level healthcare providers are being taught higher level skills to avoid having to pay larger salaries. First interview assessment was actually with my mentor, Dr. Ari Fleshman. He works for Metro Anesthesiology, and we talked a lot about just the basics of anesthesiology and how it works. I learned how you're employed and how anesthesiologists, they work for either groups or for a hospital. They usually don't work individually. My second interview assessment was with Dr. Mark Magolis, works for the same company, and we talked about the evolving healthcare field and how it will affect people in the future with all the things coming up, such as the Affordable Care Act and various acts in healthcare. With that coming around, how doctors perform their medicine and how just various aspects of how the hospital runs is going to be drastically changed. Third interview assessment was with Dr. Roy Ivey, works for the same company, and we spoke about the impact of college and how undergraduate degree affects your future. It's very important to go to college and get education, and he gave me a lot of great advice about my college decisions and different things to look for when I'm choosing a medical college or a graduate program, anything like that. Fourth interview assessment was with Dr. Ramsey Stone. He is actually a general surgeon working for North Texas Surgery, so he's not an anesthesiologist, but the nice thing about interviewing a surgeon is you can get the opposite viewpoint. So you can learn what it is like for a doctor or a surgeon to be involved in the operating room versus the anesthesiologist. And they have a little bit different viewpoints. Like with the surgeon, they work more of a 9-to-5 job or more of a stable work schedule, where anesthesiologists can be on call and can vary. He can be working from 7 to 2 or 7 to 5 or anything like that. And my last interview assessment was with Dr. Kirk LeBlanc, and he talked a lot about the ethical issues arising with the healthcare field and talked about the differences between large and small anesthesiologist groups. Now, my original work proposal was to develop a system that would allow vital signs to be taken wirelessly on a large-scale operation such as a hospital, and it would be one system that could be used throughout the healthcare stay. You would get constant accurate data, and then it could be implemented in new and existing hospital infrastructures. Now, the problem today is you look at a typical patient room in a hospital, you see 4 or 5 different devices around their bed, various monitoring devices connected to them, and these cords are hanging all over the place. It's very it takes up all the space in the room. It's an eyesore, and it doesn't always look that great. And it does affect patient movement and freedom because they have blood pressure cuffs, EKGs connected to them, pulse oximeters. They can't really move around when all that's connected. So the problem that I saw is systems and procedures for taking vital signs on patients is largely outdated. Separate devices are usually used to take each kg blood pressure, oxygenation level, and pulse. Vitals are taken at every stage of the hospital by different devices. So you look at this, it's a very ineffective way of working in the hospital, because someone that has to come into the hospital, say for instance they go to the ER. You go to the ER, you get hooked up to your monitors. They take your blood pressure, they check your heart rate, your EKG, they check your pulse, everything like that. But then say they have to go to surgery. Now they take all those devices off, go to the surgery, the operating room or the pre-op, and then they get new devices attached to them. So now we just wasted 2 devices, and now they have to go to the OR, and then they have to do it again. So now they're in the OR and you wasted 3 devices, and then after the OR they have to go to the recovery room, and they detach from the OR and go back into the recovery room and reattach all those monitoring devices. So all in all, it's not an at all effective way of monitoring vital signs because you have to constantly remove and adhere different devices to these patients every time. And like I said, you can see, for instance, in this picture, an EKG, you could have 3 to 12 different leads, which are the little colored cables connected to you at one time. That's 12 cables connected to your body. Now, that is definitely not going to be a way for you to be moving around. It's not comfortable at all, and it's usually pretty bulky. And then your blood pressure gets taken, and that's a separate device. Now, your pulse and oxygenation level are checked, and that's usually connected to a different device. And then your temperature can be taken. So all these devices are separate. Some of them can be integrated, but most of them are separate. So you can look at it and say, okay, why do I have to use 4 devices that are different every time I go into a hospital or to a different department? Now, I said the solution would be a wireless device that would communicate with various monitors throughout the hospital. So imagine that you have 1 device or 2 devices that are connected to a patient. Now, they're wireless and they communicate with a monitor display in the room. So it doesn't matter where they are. They can be in the OR, they can be in the patient recovery room, they can be anywhere in the hospital, and you go to a monitor and that information can be wirelessly transmitted to that monitor. You instantly know, the doctor will know, okay, what's the blood pressure, what's the heart rate, what's the oxygenation level, how's everything looking, without having to waste 5-10 minutes reattaching different devices, detaching devices, waiting for everything to get inflated, deflated. It saves time and saves money because you're not using so many different devices. Now, my ideal for this device is when you go into the hospital, you would be given a specific device that would be coded to you when you go in. So say John Smith gets his EKG, his blood pressure cuff, heart rate, or his pulse oximeter, and boom, he's good to go. Now, those devices stay with him throughout the stay or throughout the hospital stay, and now the nurses, doctors, everything like that, they can wirelessly retrieve that information and activate those devices without having to be directly in the room or directly in a close proximity or anything like that. So it's a way of kind of avoiding death that can occur because of sudden changes in vital signs. That's one of the top reasons that people die in hospitals, because of sudden changes in vitals that aren't seen by the healthcare professionals beforehand, because they don't have these live or these wireless monitors. And one thing that it would really do is decrease the risk of contact spread communicable diseases. That's a really, really big problem with just anything in a hospital. The more times you touch something, the more times someone with an infection touches something, the more chance you can have of spreading a disease or infection. So by using one device, you decrease the risk of spreading a disease to a different patient, because you don't have to clean that device every time. You just give the patient that device, and at the end of the day, they give it back, and you go ahead and clean it up and sanitize and everything like that. Versus nowadays, you have to go into each room after a patient leaves and clean off each separate device to make sure that it's sanitized, which half the time, if you have a nurse or someone that doesn't know that it wasn't sanitized, or honestly doesn't really care, maybe they think, oh, well, it's okay, we just took their blood pressure, they didn't have anything wrong with them, then that's where you start running into issues. Now, how would it look? For instance, this is like a wireless EKG. Now, it wouldn't be connected to like a phone or anything like that, even though that could be an application. It would be, you can see how 3 leads versus 12 leads. So it's a lot nicer to have 3 devices connected to you than 12 different devices. Now, with this, they do have current implementations of like wireless EKG monitors. That's the little device in the middle is a transmitter that transmits it to say a monitor or anything like that. So for instance, this kind of device would be something that you could already apply. You would just need to be able to get monitors that would integrate all these different devices. And then next, this is a wireless blood pressure cuff. Now, this specific one hooks up to your phone, and you can wirelessly track your blood pressure with a phone over Bluetooth. Now, my blood pressure cuff would be wireless, and it would use a similar technology, but it wouldn't communicate with the phone. It would communicate with various different monitors and workstations within the hospital. And then your wireless pulse oximeter, similar to this, it would just connect to one finger, nothing crazy, not heavy, it's not hard for the patient to wear, and then you can wirelessly track that information without having to worry about going into the room, attaching the oximeter, waiting for the device to read it, everything like that. And then on the last picture, I kind of showed, for example, what the monitor would look like. It would detail your EKG, that's all those lines right there in the middle, and then in the corner you can see that they have your pulse and your blood pressure and everything like that. So that's an example of what it would look like. And right now I am currently working on producing a prototype for all these devices and a way of integrating them, and I'm also working on creating a video to detail the before and after effects of a product like this. So that's what I'm working on right now. This is my kind of mid-year recap on what I'm doing, and for my final product, I hope to be able to bring an actual device to show you guys in detail. So I really wanted to thank you guys for listening to my presentation. I really appreciate all your feedback, and thank you so much.